There's also breaking news coming in from South Carolina tonight in a death penalty case making national headlines.
A Greenville County man is scheduled to be executed on Friday by firing squad.
Brad Sigmon killed his ex-girlfriend's parents, David and Gladys Lark, in 2001. It's now been more than 20 years. Sigmon has spent in prison awaiting his execution.
For the first time in 15 years, a death row inmate has now been executed moments ago by firing squad instead of the electric chair or lethal injection.
Today we're talking capital punishment. Yeah, I know, it's not the topic that you were thinking of, but hear me out. We've got a problem. Recently, 67-year-old Brad Sigmon, an American convicted of the 2001 double murder of his ex-girlfriend's parents in South Carolina, was executed by firing squad, a method he chose over other state-approved options. It's a method that feels like something out of history books or something from North Korea, yet it's surprisingly still in use today.
In recent years, there's been a reevaluation of the firing squad as a possible method of execution, primarily because lethal injection has only gotten worse over the decades.
This controversial execution comes at an equally controversial time. Figures like Donald Trump have even thrown around the idea of instituting the death penalty for drug dealers. Sure, he says a lot of things, but with him back in office and already rolling out some pretty wild policies, it's not exactly unrealistic. The problem? In a country with a legal justice system plagued with a variety of problems, including racial bias and drug-related convictions, that's a really risky proposition.
Since the death penalty was reinstated in 1976, more than 1,500 people have been executed by the United States government. In that time, 190 people who were sentenced to death have been exonerated.
For that reason alone, the possibility of wrongful convictions, capital punishment isn't something to wave around recklessly. But the death penalty in general raises a bigger question. What is the most humane way, if any, to extinguish the flame of life? As a society, and especially as medical professionals, we're tasked with preserving life, not ending it. Even in the name of justice, taking a life demands immense caution and care.
The death penalty seems brutal,
outdated,
atrocious, a great idea. It is silly to keep them alive and keep them fed, clothed.
So today, we'll explore the methods used in executions and ask, how do these methods work in terms of how they interact with our physiology, our cardiovascular, nervous, and respiratory systems, and what do they mean in the context of a society that claims to value life?
In a lot of ways, the death penalty functions as like a 15th century or a medieval solution to a very complicated set of 21st century problems.
Now, before we dive into execution methods, let's take a moment to talk about how the body naturally approaches the end of life, such as in hospice and palliative care, where the focus is on comfort, dignity, and allowing the body to follow its natural course.
Hospice care is about quality of life instead of treating a specific disease.
It allows them to receive the care and attention that they need in a compassionate, individualized, very well-rounded way.
This is the gold standard for humane care. It respects the body's processes, even as they slow down.
They may have symptoms that are then treated by the physician, but they also listen to their spiritual needs and emotional needs. And we have music volunteers and massage therapists and pet volunteers. They really get to know the whole patient. This is what this whole person needs, not just the disease, not just the symptoms.
And of course, depending on whether it's a terminal illness or natural aging, the symptoms and pain management may differ. But as a general overview, let's say for natural aging, this is what's actually happening to the patient physiologically during this time. Let's break it down.
Often the patient may become drowsy and begin to slip in and out of consciousness.
First, the nervous system. Pain perception is a key factor at the end of life, and hospice care often uses medications like opioids to manage it. These drugs bind to receptors in the brain and spinal cord, blocking pain signals and providing relief. It's a delicate balance. Enough to ease suffering, but not so much that it hastens the end. This is the body's way of saying, let me go, but let me go peacefully.
So by addressing the physical distress, it did help them to feel comfortable. They are able to still practice things that they like.
Next, the cardiovascular system. As the heart weakens, it pumps less efficiently, reducing blood flow and oxygen delivery to tissues. This gradual slowing is part of the body's natural shutdown process. The heart, which has worked tirelessly for decades, begins to rest. Finally, the respiratory system. Breathing becomes shallow and irregular as the body conserves energy. The lungs, which have been the gateway for oxygen and life, start to slow down. This isn't a failure, it's a transition. The body is winding down.
Sometimes we find that as the body slows down, the secretions in the lungs can make a rattling noise. It's often known as the death rattle. That's basically where, because of the weakness and the deterioration of the patient, they're not able to cough or spit out any secretions that arise.
This is what it looks like when we let the body take the lead. It's a process rooted in respect for life, even as it ends. A transition guided by dignity, comfort, and care. Hospice and palliative care show us that it's possible to honor life and death without force, without violence, and without haste. It's a reminder that our role as medical professionals and as a society is to support these natural processes, not to override them.
It's about patients and families saying, my treatment or my illness doesn't have a treatment. But that doesn't mean that I don't have hope, that I don't have happiness. Most people wish to be in the place where they've lived. They don't want to spend their last moments and days in the ER or in the hospital.
But what does this tell us? It tells us that the body is designed to transition with grace, even in its final moments. And it shows us how resilient our spirit is, and even our body can be, even in the face of death.
And it's amazing to see that some people actually graduate from hospice. They end up living much longer lives.
Hospice nurse Derek Flores emphasizes that hospice can be transformative rather than a death sentence, particularly because of how it respects the non-physical aspects of dying, something often overlooked when discussing something as harsh as execution methods. Tending to spiritual and emotional needs in hospice shows us how much of our life and will to live is directly related to connection.
There's so much hope in hospice. Hospice is all about relationships. It's about opportunities to make things right that were wrong during your life. And so many patients, unfortunately, at that age, don't have many visitors. So the hospice team can actually be a family that comes in and spends time with somebody who's really been alone for a long time.
Knowing someone is there for you and cares about you makes a world of difference in people's quality of life. Some may argue that those convicted of crimes deserving the death penalty don't deserve TLC. But as a doctor whose role is to heal, I cannot get on board with that. Because when I see these criminals, I see those in need of healing. The very purpose of medicine is to put healing first. In a sense, healing over feelings. And that means extending dignity indiscriminately, acknowledging all life as worthy of healing and, frankly, worthy of life. This principle doesn't change no matter their circumstances, sometimes as ugly as they may be. The holistic approach of hospice stands in stark contrast to the methods we'll discuss next, which focus solely on ending life, often without regard for the person's humanity. And as we move into discussing execution methods, we'll see how these principles are often disregarded in the pursuit of justice. Methods like firing squads, electrocution, and lethal injection forcibly interrupt the body's natural processes, raising a critical question. Can justice ever truly be served when it conflicts with the sanctity of life? As we explore these methods, keep this in mind: the body's resilience, the importance of dignity, and the value of every life. And this is not to say that these criminals should not bear the responsibility for their actions. First, let's examine the firing squad, a method that feels like it belongs to another era, yet was used as recently as just a few weeks ago in the case of Brad Sigmon. He chose this method over others, perhaps believing it to be quicker or more humane. But what does this method actually involve, and how does the body respond? Well, we're going to enlist the aid of retired military man Garen Thumb to get a clearer visual.
A very good approximation of what the human body is. We have bone, we have blood, we have organs. 3, 2, 1.
In a firing squad, multiple shooters, often volunteers, aim at the condemned person's heart, marked by a red bullseye target. The goal is to cause massive trauma to the cardiovascular system, stopping blood flow and oxygen delivery to the brain, which should lead to a rapid loss of consciousness and then death.
Look at the flowering off those rounds entering. Like, that is beautiful ballistics when they came in.
He just doesn't have a chest anymore.
First round when it came through, you can see he completely shattered the rib and went straight through the heart. That's death right there. Here we have these two, came through the lung tissue, blew out the ascending aorta. Upper round right here, traveled through, shattered the collarbone. If we come out the back, because we had 2 rounds exit out through the lungs, you can see all this tissue coming out. 1 round go through the spinal cord. That's, you're donezo, dude. Death, man. This is quick.
So it should mean minimal pain and immediate death, except that the body's resilience can complicate the process. For example, the heart is a remarkably resilient organ. Even after significant damage, it can continue to pump blood for a short time. If the shooters miss the mark or fail to completely destroy the heart, blood may still circulate, keeping the brain oxygenated. This means that the person could remain conscious for several seconds, perhaps even a minute, prolonging suffering. The brain, meanwhile, requires a constant supply of oxygen. Without it, neurons begin to die within minutes. But this process isn't instantaneous. And the autonomic nervous system, the part of the body that controls involuntary functions, can keep the body functioning briefly, even after catastrophic injury. In some cases, like decapitation, reflexes have even been observed for seconds after death. This resilience is both awe-inspiring and, in this context, deeply troubling.
After watching an execution, he called out the condemned man's name right after the beheading. To his shock, the decapitated head opened its eyes and actually turned to look at him.
But let's get back to Brad Sigmon's case. The execution began just after 6 o'clock on March 7th, 2025. Sigmon was strapped to a chair, which had a basin underneath to catch blood. 3 volunteers fired from just 15 feet away, aiming at the red bullseye over his heart. He was shot with specifically designed bullets meant to break apart on impact and cause maximum damage.
So to be clear, there's a little bit of lag and stagger between all the shots. Like, they're not going to be perfectly timed. You're kind of going to get 4-ish rounds in around a second. It's kind of brutal.
Witnesses reported that his chest rose and fell several times after the shots were fired, a sign that his body was still struggling to function. It took a doctor 90 seconds to examine him and declare him dead. Even in this highly controlled scenario, the body's resilience was on display, raising questions about how humane this method truly is.
We perceive of our methods of execution as being humane, as being sort of medical procedures, as being this sanitized process like you would do with assisted suicide or a pet that needs to be euthanized. The firing squad is fundamentally violent. It uses force to kill, and even if it's not necessarily more painful as an objective matter, it is more violent.
The firing squad is often seen as a relic of the past, but its use in modern executions like Brad Sigmon's reminds us that the past isn't as distant as we might think. While the goal is a quick and painless death, the body's resilience often complicates this process and can prolong suffering in ways that are hard to predict or control. This raises a critical question. If even a method as seemingly straightforward as a firing squad can't guarantee a humane death, can anything? Next, let's look at electrocution, a method that uses high voltage electricity to disrupt the body's electrical systems, specifically targeting the heart and the brain. First, the person is strapped into a chair.
Saline-soaked sponges are placed underneath electrodes all over your skin.
We all know not to mix water and electrical outlets if we don't want to get shocked. Well, that's essentially what's happening here, but intentionally. Saltwater soaked sponges are placed on the skin to improve conductivity, ensuring the body absorbs as much electricity as possible.
The condemned person is hit with 2,500 volts of electricity for 15 seconds. To compare, this current is 10 times deadlier than household electricity.
The primary goal is to override the heart's natural rhythm, causing cardiac arrest. The sponges are placed in strategic locations to focus the current on the heart and the brain, but this also amplifies the physical effects, which can be devastating.
A single shock knocks them out instantly, forces their heart to stop, shatters bones, and burns their skin with unbearable pain.
Here's how it works physiologically. The heart's electrical system relies on the sinoatrial or SA node to regulate its rhythm. High voltage electricity overwhelms this system, causing chaotic contractions known as ventricular fibrillation,
resulting in a quivering or fibrillating heart that doesn't produce a pulse or adequate cardiac output.
The nervous system, which is highly conductive, is also severely affected. Electricity overstimulates sensory nerves, causing intense pain. At the same time, the muscular system responds with violent involuntary contractions. These contractions can be so forceful that they cause fractures or dislocations, adding physical trauma to the process. And of course, the electricity generates intense heat as it passes through the body, causing severe burns at the points of contact, typically the head and the leg. These burns can be deep, affecting not just the skin, but also the underlying tissues and blood vessels.
I'm going to create a path for 120 volts to flow through the hot dog. Notice how the hot dog burned from the inside out.
In theory, electrocution should lead to a quick death, but in practice, it's far from foolproof. But the body's electrical pathways are complex, and errors in voltage or application can lead to prolonged suffering. It's not always as instantaneous as shock applied, heart stops.
After waiting 15 minutes, an official checks to see if they're still alive. If they are, a second shock is delivered at a slightly lower voltage.
Electrocution, like the firing squad, underscores the unpredictability of execution methods. Despite their intent to be quick and efficient, the body's resilience and complexity often complicate the process. Which brings us to the next method, lethal injection. The most common execution method in the United States today. It uses a combination of drugs to induce unconsciousness, paralysis, and cardiac arrest. While it's often portrayed as the most modern and humane option, it has actually been receiving a lot of criticism lately. But before we talk about what can go wrong, let's discuss what happens when it goes right, which in this case still feels kind of wrong to say.
Okay, would you take lethal injection?
Yeah, for sure, because they put you to sleep first.
It doesn't always work. How long does lethal injection take? Like 30 minutes?
Yeah, yikes. But here's how it's supposed to work. The first drug, usually a barbiturate like sodium thiopental, targets the central nervous system, depressing brain activity to induce unconsciousness. Depressing brain activity, you say? What does that mean? Do you get sad? No. I'll let Human Anatomy Channel's Dr. Wheels explain.
As it enters the bloodstream, it acts on neurotransmitters in the brain, slowing down communication between brain cells.
This also reduces the brain's control over vital organ systems, like the cardiovascular system, aka the heart, and respiratory system, aka the breathing or the lungs, slowing their function as well. The second drug, a paralytic like pancuronium bromide, shuts down the respiratory system.
It immediately starts to block acetylcholine receptors at the neuromuscular junction.
It paralyzes the diaphragm and intercostal muscles, which means you physically can't draw breath anymore. And so the body just stops breathing. The final drug, potassium chloride, targets the cardiovascular system.
The precise ratio of potassium and sodium ions that govern the heart's electrical signals and rhythmic contractions is disrupted.
Once the electrical activity of the heart is disrupted, it goes haywire.
This disruption sends the heart spiraling into a chaotic, abnormal rhythm known as arrhythmia.
Once the heart stops pumping, the circulatory system can no longer work properly.
Oxygenated blood can no longer be distributed throughout the body. All organs are now cut off from their vital supply of oxygen and nutrients.
And as Dr. Wheels explains, at that point, the body succumbs to catastrophic, irreversible damage. And within a minute, it's all done.
The electrocardiogram in the execution chamber flatlines. The IV team checks for vital signs, and the warden closes the curtain to the observation room.
Again, in theory, lethal injection should be quick and painless. In practice, it's far from perfect. Botched executions, where the drugs fail to work as intended, have raised serious ethical concerns about this method.
He was struggling to talk, but those were the words we got out. Man, I'm not
and something's wrong.
The last words spoken by Oklahoma inmate Clayton Lockett, uttered during his botched execution. But witnesses say Lockett was still conscious 7 minutes after that first injection. At 16 minutes, he seemingly tried to get up and talk.
At any point in this process, there can be complications. Just as we see with anesthesia administered for surgery, every body is unique and reacts differently to drugs. Anesthesia cocktails are carefully personalized because many factors like a patient's age, fitness, or medical history can alter the way the drugs work.
The challenge lies in accurately assessing these factors and tailoring anesthesia to suit each patient's specific physiologic needs.
Similarly, in lethal injection, individual factors can affect its efficacy. For example, variations in metabolism can impact the efficacy of the barbiturate used in step 1, meaning there's no guarantee the person will be fully unconscious. In step 2, if the sedative hasn't worked, the person may remain aware, unable to move or breathe while experiencing suffocation. And in step 3, if the sedative and paralytic haven't worked as intended, the final drug, potassium chloride, can cause excruciating pain.
Lockett, however, remained conscious after all 3 drugs were administered and reportedly began writhing and seizing. According to Oklahoma's Department of Corrections, Lockett experienced a vein failure and died of a massive heart attack later that evening.
Mind you, with regular anesthesia practices, doctors expect the patient to actually wake up. So they have to be extremely precise and careful. Anesthesiologists train for years to master the science and art of administering these drugs safely. However, the people administering lethal injection are typically not medical professionals. In fact, most doctors and anesthesiologists are ethically prohibited from participating in executions. Instead, the task often falls to prison staff or execution teams with limited medical training.
I got a phone call from Department of Corrections about helping out with the execution process, which here in Georgia is lethal injection. Sometimes in life you have to take the bad with the good. It's part of being a leader. It's part of being a totality of a healthcare solution.
Now, you might think it's the death penalty. Why does being careful matter? Well, even in executions, there's an ethical obligation to make the process as humane and comfortable as possible. But it's hard to know how painless it really is, because obviously, almost all of those who undergo it aren't around to give their testimony.
Yet Willie was able to yell out for help. The needles and pinpricks all over his body, as painful as they would have been, seemed to fall short of the pain you'd expect from an effective execution.
So lethal injection, like the other methods we've discussed, highlights the challenges of trying to control the body's complex systems. Despite its modern appearance, it's not immune to failure. And when it fails, the consequences are devastating. This brings us back to the central question. Is there truly a humane way to extinguish the flame of life? The truth is, no method is really truly humane. Our bodies are designed to survive, to fight for life, and to heal. Even in the face of extreme stress, the body systems resist shutting down completely. And this discussion isn't just about the individual body, it's about the body of society. Just as we talk about the health of a person, we must also talk about the health of our collective ecosystem. Situations like these are often symptoms of a deeper issue, a failure somewhere in the system that needs addressing. As psychiatrist Dr. Soham Das explains.
So the first thing I'd say is that people make rational decisions most of the time. So if you come from a really rough neighborhood where there's really poor schools, high unemployment, lots of drugs, say in America, booze and gun stores, we don't have gun stores in the UK, but just an environment which is broken, then everybody in that environment is more likely to commit crime and also to be a victim of crime.
But the death penalty has never been about justice. It is about retribution, it's about vengeance, and some of our ugliest societal impulses and urges.
We must remain true to our values and morals, even in the face of actions we find reprehensible. To do the very thing we are punishing another for, to take a life in the name of justice, shows that we haven't truly learned. It's a cycle that perpetuates harm rather than healing.
More than 70% of the world's nations have gotten rid of the death penalty. It's time Americans ask themselves, do we want to be a country that allows the government to arbitrarily decide who gets to live and who gets to die?
No one is truly dispensable, and rehabilitation and prevention are not just individual responsibilities, but collective ones. This means ensuring people feel supported by their communities and have access to the help they need before reprehensible crimes are committed.
Perhaps you believe he no longer deserves his life.
I know what I did was wrong, and I know that I deserve to be punished for it.
But do we as a society deserve to take it?
Thanks for joining me in this discussion about the humanity of execution. If you learned anything in this video, then leave a comment and give it a big thumbs up to feed the algorithm. If you didn't like the video, be sure to let me know why in the comment section down below. For sneak peeks of my videos before they go live, consider becoming a member of the channel. We are working towards a goal of 1 million subs, and we can't do it without you, so let's make it happen together. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the place where you live. Otherwise, as always, that's been a word from Dr. Chris Raynor, not your everyday ortho, where we see one, do one, teach one.